Hello, my name is Erming Tian. I'm an assistant professor working for Myeloma Institute for Research and Therapy at the University of Arkansas for Medical Sciences in Little Rock, Arkansas. I'm here at the ASH meeting presenting abstract entitled Cytogenetic feature of a patient with monoclonal gammopathy of undetermined significance, also called MGUS, and asymptomatic multiple myeloma, also called smoldering myeloma. MGUS and AMM are precursor stage of multiple myeloma, and so far the diagnosis for these two stages of disease all based on the clinical parameters such as total M protein in serum, percentage of plasma cell in bone marrow, and if there's organ damage or bone lesion. But we think that's not good enough to separate the patient and to predict if a patient would have a progression disease. So that's the whole experiment about. We developed the new the probes for fish at the immunoglobulin heavy chain, immunoglobulin heavy chain gene at the chromosome 14 Q arm 32 region, and we have two probes, one for constant region, another one for variable region, and by doing fish with two probes together and separate plasma cell with either kappa or lambda immunoglobulin heavy chain staining, so we can better find if there's a dominant clone in MGUS or AMM in the patient. We did this same procedure on normal donor bone marrow sample, and MGUS patient, and AMM patient, and some myeloma patient. What we found is even in healthy donor, there are heterogeneity of clone, plasma cell clone in either kappa or lambda. So definitely there's a polyclonal stage of the plasma cell development. And also we found that there's a polyclonal stage in MGUS and AMM. We done fish on about 100 patients that were diagnosed with MGUS. We found about 50% patients had a polyclonal PC stage, and another 50% had a dominant clone grown out of the bone marrow. In AMM stage, we found about 15% patient, 15% patient had polyclonal PC, but 85% patient had monoclonal disease. We were not only down on this immunoglobulin heavy chain gene, we also look at the 1Q21 region by FISH, and also P53 by FISH if there's a P53 gene deletion, which is at the 17P region. And also we look at the immunoglobulin heavy chain translocation with the partner genes such as MMZ, FGFR3, cyclin D1, cyclin D3, MAF, and MAFB. By combination of all these FISH results, we can confidently say to predict if a patient is going to progress to next stage of disease.